Welcome everyone to today's webinar, the 2023 Healthcare Executive Report, a live analysis. On behalf of Becker's Healthcare, thank you so much for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Also, if at any time you do not see your slides moving or have trouble with audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are always here to help. With that, I am absolutely pleased to welcome today's speaker, Dr. Iman Abuzetti. Iman is a medical doctor with an MBA from the Warren School of the University of Pennsylvania, a McKinsey alum, and a software product manager who 5 years ago founded Incredible Health, which is the fastest growing career marketplace for healthcare workers in the U.S. and is used by more than 650 leading hospitals today to hire permanent nurses. The company is the highest valued tech-enabled career marketplace for healthcare workers, and Iman is one of the 4 Black female founders to be running a company valued at over $1 billion. Wow. Iman, thank you so much for being here today. I'll now turn the floor over to McKay from the Incredible Health team.
Awesome. Thank you so much, and thank you, Iman, for joining us today. We're excited for the agenda. We're going to talk a little bit about the nurse labor market today. We're going to dive into the study results and analyze those data, and then take whatever questions you have. If you do have questions, just type those in. We'll address as many as we can as we go, and then we'll also address some at the end as well. So any words of introduction or thoughts before we start, Iman?
No, I'm just happy to be here, and thanks everybody for joining.
Yeah, we've got a big group on today, and we're thrilled about that. It's always fun to talk to a large group about this stuff. Okay, let's talk market overview. So 1 in 8 Americans work in healthcare. We know that. It's been the #1 employment sector for quite a while. The demand for healthcare is increasing, but the workers, as I'm sure you all can attest, have been decreasing, and that demand has become a problem. And it's a national problem that's getting worse. So about 1 million nurses short by 2030 in the U.S., about 22.5 annual acute care nurse turnover % on average every year. And then the one that startles me when I look at this is 95 days is the average time to hire a permanent specialized nurse. This number has kind of floats between that like 88 and 95 day range. It's sitting right about 95 right now. It's kind of been there for, a while, a couple of years, right, at that number I'm on, and maybe it's even been longer in that 90-day range.
Yeah, it certainly has been at the 90-day range for quite some time. McKay, sorry, could you just slow down just a little bit? You're speaking really quickly.
Yes, of course. Sorry.
Okay.
I get excited.
Yeah.
I get excited. No, I think the thing that I'm as I look at this, the thing that I am sort of overwhelmed by is how dramatic this problem is in terms of the national nurse shortage. Like, it's something that I think you saw when you started Incredible Health, but it's something that isn't going away, maybe is the best way to say it.
Yeah, that's absolutely right. I think that the number that's in particular just not moving much at all is the turnover number. It has increased throughout the pandemic, and then even now it's starting to decrease in some parts of the country, but it's still pretty stuck at this 22% level in most parts of the country.
Yeah, that's really interesting. And where do we fit in? Incredible Health uses our custom matching technology to help hire quality permanent nurses in less than 20 days. Compare that to, as I go back to the previous slide, the 95-day average, where we're sitting right now. I think the 20-day average is a dramatic improvement on that. What are the benefits of hiring permanent nurses more quickly? Obviously, there's a time saving that's inherent, but there's got to be a financial savings and an efficiency savings for these health systems and these hospitals. And obviously, I think there's patient, experience improvements with having more permanent nurses as well.
Yeah, absolutely. There's a whole series of benefits with hiring faster. If you hire more permanent nurses faster, you're able to reduce the number of travel nurses on your units, which leads to huge cost savings for the hospital. We estimate we save at each hospital location at least $3 million per year. Obviously, it gets your units more staff, so it keeps your nurses that are there happier. For nurses in particular, it gives them access to opportunities all over the country that they may or may not be aware of. And then it also just helps them reduce their commute times, advance their careers, look for find more flexible scheduling. So lots of benefits to hiring faster.
Yeah, it's huge. And then, as was mentioned at the start, trusted by over 700 health systems and hospitals, that we help hire permanent nurses in under 20 days. And you can see some of those names on the screen there. It's an honor to work with so many wonderful health systems, and that's growing every month and every quarter, the number of hospitals that are working with Incredible Health. Okay, let's talk about the study, and I'll provide a little bit of background on the methodology. We'll talk about some of the places where the study's been covered, and then we'll dive into the data itself. So about 100 U.S. health system senior executives were included in the study. The data was gathered in June of 2023. And we reached out to these health system senior executives, and we're talking C-suite level people. And we asked them, there's like 32 questions. It broke every rule in terms of like how many questions you want to ask somebody. But they were gracious and answered these questions. And we got a ton of really good data. Now, we're not going to go through every single piece of data today. We're going to analyze what we feel were some pretty important components of the data. And then following the webinar, we'll send you the hard copy of this study so you can review the full data set as well. So the other thing I wanted to highlight is the coverage of the study. You can see, just some of the entities that covered it. This is just a smattering, a sample of the media outlets that have covered the study so far. And it's been an awesome experience to see how many people have cared about this data and are interested in this data. Anything you want to say about the study, the reaction to the study, or the methodology around the study itself, Iman?
Yeah, absolutely. First is that the 100 health system executives that are in where we were able to collect the data, they represent health systems across the country. So there isn't one single geography that's it's focused on. We have academic medical centers, we have non-academic, we have community hospitals, we have urban areas, rural areas. We have very small, like single hospitals, and then also very large health systems included. So it's definitely a wide range. And then the second thing I wanted to mention is just some of the reactions of the executives to the study results that we're about to go through. I just wanted to highlight a couple. So, Janice Walker is the system CNE at Baylor Scott & White. And her reaction to the study is, organizations need to become more candidate-centric in their efforts to recruit strong nursing talent. And we cannot just rely on our reputations, but we have to put in place active, aggressive work streams to go after the talent, no matter what the age and experience level is of the nurses. Tommy Bassett, he's an MD, CEO of Bassett in the New York area. He describes about his reaction is that it's clear that the paradigm is shifting and there's been permanent effects on nursing care. And so he is also proactively implementing many different models to improve the nurse hiring and nurse retention at his organization. And then similarly, Janice Nevin, who's the CEO of ChristianaCare, reacted to the study. And she appreciated that the study quantified some of the changes and challenges that they're experiencing as well. And it's just, we have to be clear and upfront with younger nurses as well about and addressing what matters most to them. So it's had a really strong reaction to the hospital executives, and just like looking forward to walking through some of the data and results.
Awesome. And then the other thing I should point out as well is this was not a study of just Incredible Health customers and partners. This included some hospitals that we work with, some that we don't. It's pretty inclusive of each group. So with that, let's dive right in. So nursing shortage, let's begin there. 94% of the health system executives that answered the survey described the nurse shortage as critical which highlights the urgent need for effective strategies to solve this problem. I'm guessing this doesn't surprise you, Aman, given the number of health systems we talk to, what they tell us, those that we work with. This is not a new problem, and it doesn't appear that it's one that is going away anytime soon.
Yeah, absolutely. I mean, when we started working on this problem, it was prior to the pandemic, and then we went through the pandemic, and we're now in this post-pandemic phase. I think some leaders had a wishful thinking that things were going to get easier now in 2023. And yet 94% of executives still describe the nursing shortage as critical. That just speaks to the underlying demographic trends that are happening in this country. Our population is aging. That means that there is more and more patient demand overall. And we as a country haven't done a phenomenal job of increasing the number of healthcare workers and nurses in order to meet that demand. And so this is an underlying demographic trend that is very powerful and probably trumps any pandemic or any other short-term impact. So it's just really drawn out, and it's projected to stay for many decades to come.
Yeah, that's an interesting point. I think it's fascinating to look at the demographic trends that are sort of part of this and are leading to those shortages. The other thing that we were focused on a little bit is experience and tenure. We asked a few questions about this, and I'm going to read this first bullet point because it's kind of a complex piece of data, but let me read it. 40% of health system executives reported that more than a quarter of nurses in their system have less than a year of experience. And then previous experience is the most common thing that hospitals are saying they look for. And then 53% of nurses at their institutions had an average tenure of less than 5 years. So I think the headline for this slide, if you will, is really a lack of tenure in a lot of situations for a lot of health systems. Like when 40% of these systems are saying that a quarter of their nurses have less than a year of experience, that's like kind of startling. I didn't realize, and I don't think we had a clue that it was that inexperienced, the tenure was that low. Is that also a trend, or do you think that is a function of just post-COVID where the profession is, Aman?
Yeah, I think it's just an impact or a consequence of the shortage. So as the number of as the competition for experienced nurses continues to increase, because we have a labor shortage. Many hospitals and health systems are looking to the new graduates and to the younger nurses to fill their ranks. Now, before the pandemic, in any given market where we were operating, maybe there would be only a couple of employers that are very active in hiring new graduates. But now, I mean, fast forward a few years, and usually 70-80% of the employers in a local area are very active in hiring new grads as well. And so the competition for new graduate nurses and for younger nurses has increased. Also, we just don't have enough experienced talent to fill all these roles. And so there's just more and more emphasis on the new graduate nurses. And so we cannot take this cohort for granted. I mean, I think we did, honestly, before the pandemic, where it was like, it was always easy to hire new graduates. That's not at all the case anymore. Now, there are many consequences to having less experienced talent on the floors, right? There's safety consequences, there's quality consequences. There's had to be more investment in onboarding, in training, and so really there's been a shift that many executives have had to do in order to bring in newer, younger nurses, and also modify how they manage their nursing workforce, since such a huge percentage of them are new too.
Love it. All right, misalignment. This is and I should point out too, we did the health executive study that we're reviewing today in June. In Q1, I think it was in February, we surveyed several thousand nurses. And the thing that was really interesting was looking at the data from the nurse study and comparing it to the data in the health executive study, and realizing that there's some misalignment maybe. There's some good things, but there's also some misalignment, that some things the nurses said compared to some things the hospital executives said. One of those was health systems say that 80% of younger nurses request more flexible scheduling. So the health systems know that the younger nurses want flexible scheduling. Yet the next question asked, how many of you actually offer flexible schedules? And only 11% of health systems say they offer it. This one was interesting because it's not as if the nurses are saying they want it and the health systems are unaware of that. The health systems are aware they want it, but yet often don't provide it. Why is that, do you think? What are the reasons that it's so difficult to provide flexible scheduling? And that's kind of a subjective word in and of itself. Like flexible can probably mean a lot of different things, I'm guessing.
Yeah, absolutely. Okay, so let's define flexible scheduling first, right? So flexible scheduling is a broad term to your point, okay, and it includes, historically the main nursing shift was full-time only, 3 days a week, 12-hour shifts, right? That's usually like what most health systems had. Now, being more flexible means adding part-time roles. It means weekend shift options. It means not just 12-hour shifts, but also having 8-hour shifts and 6-hour shifts and 4-hour shifts. Essentially a menu of options for how to create your schedule. And it also includes self-scheduling too. So allowing nurses to define their schedule as well. So we're increasingly seeing more and more nurses request flexible scheduling. In fact, when nurses are signing up on the Incredible Health platform and we're asking them why is it that you're considering leaving your job, the second most common reason selected is I'm looking for a more flexible schedule. So it's a very it's a demand from many nurses, but especially the younger nurses. And by the way, this isn't just unique to nursing. I mean, we're seeing this trend in all industries where the Gen Z and millennial generations are, they are wanting more flexibility at work. Now, the reason why only 11% of health systems can actually offer it is offering flexible scheduling is a lot more operationally complex. It is tough to manage this many different types of schedules for the nursing leaders, right? And sure, there's some software that helps and so on, but just the amount of change you have to do internally, both operationally and culturally, to accommodate flexible scheduling is a lot. And so that's why there's just been a slower movement here. But honestly, it's where the talent is, and we do have to modify how we are operating in order to accommodate this request.
Interesting. Okay, salaries and bonuses. This is always one of the top and most frequently discussed topics. Sign-on bonuses continue to be the primary method to attract nurses. 35% of hospital executives say they're offering signing bonuses now. And then 26% of hospital executives say they're increasing nurse salaries overall. It's probably not surprising given that it's probably easier to get approval for a one-time bonus than it is an actual salary increase for a candidate. Is that kind of the explanation for why there's more that are offering sign-on bonuses than increasing salaries? Any takeaways or interesting parts about this data to you, Aman?
Yeah, so sign-on bonuses have become very, very popular, especially in the last couple of years. And yes, the approvals for them are easier, right? You're not increasing the overall wage, but it's a one-time bonus. And so they're easier to approve, they're easier to implement as well. And they are effective in hiring. Now, salary obviously is not the be-all, end-all when it comes to nurses and what they're considering in their new employer, but it is one of the factors.
Interesting.
And then with the increase in nurse salaries, I mean, that's no surprise, right? Like whenever you have a labor shortage, wages will go up. And so hospital executives have had to evaluate salaries, not just once a year like they did historically, but we even work with health systems that are looking at it every 6 months in order to keep up with the market.
Interesting. And as we talk here, we're getting a ton of questions. So we'll hit these. Let's hit a couple right now, if that's okay, and then we can hit some more at the end. Hannah asked a good question. She said, for misalignment, curious if there was a difference between older and younger nurses in terms of their frequency of wanting flexible scheduling. Yeah, looking at the data, there was a difference. Younger nurses wanted it more frequently. And to, I think the point we were talking about, and we didn't dig into this, and I think we will next time we do the nurse study specifically, is how do the nurses define flexible Like, what do they actually want flexibility on? Any comment on that and some of the differences we saw between younger and older nurses regarding flexible scheduling, but also any other topics?
Yeah, absolutely. I think we're going to cover that next, actually, just the differences between the generations.
Yeah. Yep.
And we'll go deep on that topic.
So let's go through some of that to tee us up here. So 35% of health system execs say there are conflicts based on generation. 78% of younger nurses are requesting salary increases versus 48% of older nurses. So the younger nurses are requesting those more often. 54% of younger nurses are seeking specialized roles compared to 14% of older nurses. And then 74% of younger nurses request immediate career advancement versus 8% of older nurses. That one to me is the most interesting, and it doesn't just apply to nurses. It's pretty broad across just the demography as well. Anything you want to highlight from this in relation to this as well as Hannah's question?
Yeah, absolutely. So the differences between generations is not unique to nursing. It's not unique to healthcare. Okay, so right. All of us in all industries, I mean, McKay and I are in software and tech, have to tackle these challenges as well. Different generations have different preferences, and that's okay. I mean, that's what makes our jobs as leaders challenging. So the hospital executives are now working with 5 generations in the nursing workforce at the same time, from Gen Z all the way to the boomers, right? And each of those generations has different needs and different asks and requirements, as highlighted in this data here, where younger nurses are more aggressively requesting salary increases, they're seeking more specialized roles, and they want immediate career advancement. Our study, I think that was done earlier this year, also showed that when we surveyed the nurses directly, the new the new nurses who were primarily Gen Z, they didn't want to go into med surg. They wanted to specialize right away, right? They also had very high expectations on compensation. They also had more requirements on flexibility. So that is just the reality of where we are. And this is now one of the biggest cohorts of nurses that are working today. And so increasingly, we're seeing more and more hospital executives put in place strategies and tactics to address these demands or these requirements, right? And it's important that they do that because of the competition, because their competition is as well. I'll give you a few examples. There's more and more new graduate programs that allow nurses to go straight into the OR or straight into labor and delivery and don't have to start at med surg. There's also more and more strategies and tactics in place to define career paths and career tracks for nurses and formalize that as well. So it's very clear when you join a health system how your career is going to evolve. And this is being documented. It's becoming part of the employee file about how your career is going to progress. And they're really formalizing the career tracks as well. So we're definitely seeing more and more movement in this area from a strategy and tactic standpoint in order to address what is now, the biggest group of nurses in the U.S. today.
How do you think, and there's a couple questions that are kind of dancing around what I'm about to ask. Mm-hmm. How do you think leaders can avoid the sort of negative connotation that they might have inherently with younger nurses, like, oh man, why are they asking for this stuff so fast? Why are they wanting, to move up in their career so rapidly? They need to put in the time. Like, what's the balance there of making sure you're not frustrating your more tenured nursing staff, but also not just totally discounting what the younger nurses may want or need in order to stay at your business, stay at your hospital?
Yeah, I mean, this is like, it's very, very challenging, right?
Yeah, there's no perfect answer.
There's no perfect answer here. I've seen, we do a whole speaker series with CNOs and CHROs and COOs across the country, at hospitals across the country. And, increasingly, they're saying, hey, we have to implement programming. Like, we just have to accommodate some of these requests. They're also investing more in nurse leadership and nurse management training, because sometimes there is some work that the nurse manager has to do to manage expectations, and to help a younger nurse understand how it is that they want to evolve their careers, because they may or may not know. I mean, they're saying they want to specialize immediately, but getting that mentorship and support from a nurse manager is important too. So, I mean, there's no right answer, but like at the end of the day, if the market and their competition locally and nationally is moving towards this direction, it's almost like we're at a point where we don't really have much of a choice. We do really have to implement more strategies and tactics to address these concerns.
That's great. All right, let's talk travel nurses, and I still see the questions pouring in, which is awesome. We'll hit them. Let's talk travel nurses though. So 96% of health system execs say they plan to prioritize permanent nurse staff over temporary staff. We saw in the survey some, I'd say fatigue is probably the right word, and I don't think that's too strong, around like the number of travel nurses that hospitals and health systems have had over the last 3 or 4 years. I think there's a real sense to move back to permanent nursing staff. 55% of hospitals say they did not increase the number of travel nurses over the last year. Does this match what we see anecdotally with our 700 plus hospital partners, Aman? Like, is this the direction they're heading?
Absolutely. I mean, it's like almost unanimous without a doubt. Like every single hospital and health system we work with has an initiative at the executive level to reduce the number of travel nurses. The part of it, the number one reason is financial, right? Hospitals are low margin businesses at the end of the day. And when you're increasing labor costs, so the temporary staff is anywhere from 2 to 4 times more expensive than the permanent staff, that's eating into your bottom line. And so there's enormous pressure to reduce the number of temporary staff, because you're also battling wage increases with your permanent staff too. So this is usually a very high priority to manage. The second reason that executives are really prioritizing tackling this is that it does have cultural implications, right? So on a nursing unit, when there are travel nurses, you can have a permanent nurse who's an OR nurse, doing the exact same job as the OR travel nurse, but getting paid only half as much, right? And that is going to cause concerns, angst, anger, all kinds of issues that culturally are not great for the long-term sustainability of that hospital's nursing workforce. So there is a huge effort to reduce the number of travel nurses, just from a financial standpoint and from a cultural standpoint. And now, of course, like they played a role. Travel nursing is they do play an important role. They are a Band-Aid and they can bridge you, right, temporarily, but it can't go on for years, and it can't go on for a long time, and you can't have enormous expenditure around it either.
Yeah, that's a great point. You can't have a huge expenditure around that. Okay, let's take a few more questions here, and then we'll go through kind of the concluding slides and then clean up any other questions that are remaining. So what is Vance asked this, he says, what's the quality impact of increased flexible scheduling? Like, is there actually a patient quality or a service quality impact? Shorter shifts mean more handoffs. Is there a quality component there? I think that's what a lot of facilities are worried about, right? Like, too much flexibility provides less coverage and potentially more problems. How do hospitals overcome that?
Yeah, Vance, it's a great question. Look, the literature does show that if you have more handoffs, there is an impact on quality of care, right? Like there's a risk of, you essentially have increased your risk of errors. And so, however, on the other hand, it is that risk of errors is dramatically less than just having an understaffed unit. And having an understaffed unit is probably the biggest, has an enormous impact on the quality of care that those healthcare professionals are able to deliver. And so it's probably a higher priority to make sure the unit is staffed, even if it's staffed with shorter shifts, than it is to simply not have the people on the floor, not have the workers on the floor. So definitely a balancing act there, but it's higher priority to make sure the unit is actually staffed.
Great point. Colleen asked, what are you seeing in terms of salary expectations? And this varies widely, so we don't need to get into dollars and whatever. But she just makes really kind of an interesting point, which is some of these pay scales and pay rates that younger nurses particularly are wanting are like not feasible for like long-term hospital function, is her words. Would you agree with that? Are you seeing, things settle where they settle in terms of salaries based on supply and demand, but like what are What are you seeing there in terms of hospitals grappling with these higher salaries? How do they make that work long term while still attracting talent?
Yeah, it's Colleen. It's an excellent question.
That's like the $1 million question right there.
That is $1 million question. So, look, the expectations of higher salaries is definitely there and prevalent. And look, in any market where you have a huge difference between supply and demand and labor is going to see wage increases, right? It's just like the laws of economics, right? I think what hospital executives are really tackling instead, right, is seeing, hey, what can I do that's ideally budget neutral that's going to help me hire and retain nurses? Because you're right, like the continuous salary increases forever into the future it is not sustainable for the hospital's P&L necessarily. So that's why we're seeing more and more investment in nursing career advancement programs. We're seeing more and more investment and changes in flexible scheduling. Because that not only is that helping nurse hiring, but that's also helping nurse retention. And so, and at the end of the day, it does match up with what nurses want. Every time we survey nurses, salary actually doesn't come up as the number one reason for why they're changing jobs. Career advancement does, and flexible scheduling does usually come up at the top, but compensation and salary and benefits is usually, towards the middle. So it's not necessarily the top issue to tackle.
Michael asked a question that you actually probably partially answered there, which is, what are you learning about what leadership can do to keep nurses over time? And you hit on what I was going to mention there, which is in the nurse study, we specifically asked, what are the things that will cause you to stay at a role longer? And it was career advancement, flexible scheduling, then salary, benefits, et cetera. But there's some qualitative things that don't necessarily like cost you more money that you can do to retain nurses for a longer period of time. Anything you want to add there? Because I know in your conversations that we do every couple of weeks with CNOs and other leaders, you hit on this a lot. Like retention comes up in every single discussion.
Yeah, absolutely. So hiring, the tactics you use to hire it's like two sides of the same coin, right? The tactics you use to hire can also be used to retain nurses.
Yeah.
And so when we're looking at the top reasons why nurses are leaving jobs, number one is looking for career advancement. Number two is looking for a more flexible schedule. Number three is something to do with geography, actually. So relocate. I want to relocate, or I want to reduce my commute time. And then four is like compensation and pay and so on. And so when implementing strategies and tactics that address the top two or the top three, you're able to not only hire more, but also retain more because you're addressing the needs of your current nurses too. So we talked about career advancement programming, formalizing career pathing for nurses. And what I mean by that is literally like by day 90 after their start date, there is a documented career mobility plan for that nurse about how their career is going to evolve at that health system. And so it's extremely clear, so they don't have to like look around and switch employers in order to advance their careers. On the flexible scheduling piece, it's essentially become a menu of options for flexibility, like weekend shifts and 8-hour shifts and 4-hour shifts and part-time roles and so on, and essentially adopting a philosophy of what we call no nurse left behind. Okay, so when you're engaging with a nurse who's already there or you're trying to hire, it is important that you take a philosophy like we're not going to leave anyone behind. We're going to find something that works for them from a career standpoint and from a scheduling standpoint. And then on the relocation piece, because there is still quite a lot of movement in the permanent nurse labor market, 1/3 of the nurses hired on the Incredible Health platform are relocating from a different state. We're seeing more and more offers of relocation assistance included in offers. And then finally on the compensation piece is just like keeping up with the local market when it comes to pay. And all of those help retention too.
Let's do two more questions, and then we'll go through a few more slides before we conclude. But let's hit two more right now. So Mary asked something we've talked about before, which is there any movement to increase nursing schools to address the deficit of nurses? This comes up a lot. Like there just aren't enough new nurses being produced right now. Have you heard anything about plans there? I know you talk with a lot of hospital executives in terms of increasing graduates, staff, and nursing schools more broadly.
Yeah, so with nursing schools, a huge bottleneck in the nursing shortage is at the nursing school level, right? Where you have tens of thousands of Americans who are applying to nursing school, but only a small portion of them are able to get in. And as a result, we have wait lists of tens of thousands long for every nursing school, where they just cannot train enough. And the main reason that the nursing school is not able to admit more students is because they don't have enough faculty to train those nurses. And so the faculty piece is like, is yet another shortage where we just simply don't have enough nursing faculty to train more nurses. And so some of the creative ideas that we've seen is health systems partnering with their local nursing schools, not only to just have a pipeline of talent from the nursing school into the health system, but also offering nurse managers that are employed at the health system to teach or be faculty at the nursing school as well. So it's almost an exchange of value. Yeah. And we're seeing that be actually very effective. We're also seeing more programming in terms of externships, where nursing students at the nursing school can participate do their externship at the hospital. Again, with a commitment to work with the hospital after they graduate. And so there's definitely more and more that we need to just alleviate that bottleneck of ensuring that we can have our nursing schools train more Americans to be nurses, because the demand is certainly there from Americans to enter this profession.
That's great. And then one more, are you seeing a push back towards permanent nurses from the nursing side? Like are nurses wanting to get into more permanent roles and leave the travel role behind, even though they were able to make more money for a period of time doing the travel nurse thing?
Yeah, the data in our marketplace is showing that phenomenon, that trend is absolutely happening. It's one of our most successful campaigns here, is to encourage travel nurses to consider permanent roles. When you think about a nurse in a 30, 40-year career, he or she is probably spending at most maybe 1 year, maybe 2 years, like maximum, as a travel nurse most of the time. And that's because, look, working as a travel nurse, although it exposes you to a lot of experiences, it is challenging, right? Like you have to move, every few months. And nurses are like the rest of us on this call. They have homes, they have families, they need stability as well. And so it is still showing that 95% of the nursing workforce in the U.S. is permanent. But prior to the pandemic, it was around 5 to 6% of the nursing workforce was working as travel nurses. During the pandemic, it increased to about 8 to 10%, and we are seeing it come back down to 5 to 6%.
Great. Okay, awesome. Let's take a break from the questions. I love these. We're at like a few dozen questions at this point, which is awesome.
Yeah, we should have some time. We should have some more time at the end.
Yeah, we'll have more time at the end. We'll have tons of time at the end. So let me just kind of give you a quick overview of Incredible Health here. As we said at the outset, hospitals are using our custom matching technology to hire quality permanent nurses in less than 20 days. You can see that list of logos we showed a moment ago. Essentially, employers are applying to the candidates instead of the other way around. So nurses love it, and you're able to fill those roles more quickly. Emon, anything you want to say about the screening, the algorithm, and the data that we provide to health systems and nurses, and kind of the overall hiring experience there?
Sure. If you just go back to the previous slide, I just wanted to highlight, we work with very big health systems like Tenet as an example. We work with large regional systems as well, like Baylor Scott and White and Beth Israel Lahey. And we work with many community hospitals too. Harris Health is an example. We work with many academic medical centers, including Cedars-Sinai and USC. And so at this point, we've had quite a large breadth of experience with union, non-union, urban, rural, big health systems, small health systems on. And so, and we never assume that every hospital is unique, but also there's a lot of similarities in terms of what they need from a nurse hiring standpoint. And so that's where we are, pull our experience from, and where some of our data is pulled from as well. As far as just like the way the platform works, our claim to fame is that the employers apply to the talent instead of the other way around. So this is a very nurse-centric, candidate-centric platform, and we've largely automated the screening and the matching between the nurses and hospitals, and that's why CNOs refer to us as the Match.com of hospitals and nurses. Now, one of the benefits that comes out of that is data analytics. So a two-sided marketplace like ours that's powered by software churns out enormous data sets. which means we have tons of insight in terms of what's happening in nurse hiring and with nurses just across the country, and are able to highlight trends and details like we are today. But even when we're working with a health system, we're able to benchmark them to their local competition and nationally as well, in terms of the practices that they're using to hire too.
Interesting. And nurses are joining the platform. We should point this out. Nurses are joining the platform. I think we have 800,000 in that range right now, because they get free education, they get salary estimators, career coaching. So we have 10,000 plus nurses joining the platform every single week. It's over a quarter of the nurses in the US now are members of Incredible Health and are using Incredible Health to help manage their career. And so nurses are there in your market. The thing that's fun is to get on these calls with hospitals and actually show them how many nurses in their market are using Incredible Health, and they're floored. They're like, wait, there's 20,000 nurses in my market that are on your platform. Like, how can I get access to these people? That's a fun call to be on, I found. And then the other thing too, and this is like human psychology, so it's not surprising. It's certainly not exclusive to nurses, but candidates are going to accept their first offer. Speed really matters in this, and that's why it becomes so important to us and has become so vital to what we're trying to accomplish and trying to do. Anything you want to say about the speed or the cost savings as you look through the hiring process with Incredible Health, Iman?
Yeah, if you go back to just the previous slide on speed, 68% of nurses accept the very first offer they receive. We know that in every single market where we operate, it is the health system that is operating the quickest, that has the fastest hiring speed, that hires the most. It's not necessarily the health system with the highest salaries. It's not necessarily the health system with the biggest brand. And really implementing work streams and operational processes that accelerate speed become a huge competitive advantage. And we see this in every single market where we operate, no exception. The reason for this is, first of all, nurses are almost always working not just full time, working overtime while doing their job search. So they are looking for fast, convenient, easy experience. Also, there's a very positive impression that's created when they have a fast, speedy, convenient experience with a health system, because they make an assumption that the rest of the health system must be operating quickly and conveniently too. And so it creates a very strong employer perception when we're operating with speed.
That's a great point. They're seeing their perception about the hospital itself and the whole system is improved if you can move quickly and efficiently. I love that. And then this is really cool. I love this breakdown. Like, this is a conventional hiring process that's taken from a real hospital client before they became Incredible Health customers, and then what that went to once they started to use Incredible Health. And you can see the increase in efficiency at every stage, but particularly that time to source is really dramatic. That decreases the cost in a real substantial way, and is, I think, core to what we're trying to accomplish. Anything you want to say on the cost savings here? Because I think, look, it comes down to the dollars and cents in these situations. But anything you want to mention on the cost savings and that the time saving produces?
Yeah, I mean, essentially, one of the reasons Incredible Health is used by hospitals and health systems is that it is a cost-saving product, right? So by hiring permanent nurses faster, you could reduce your number of travel nurses, which leads to millions of dollars saved for the health system every single year. Yeah. And so that's the sort of the financial crux of this. Now, obviously, there's many other non-financial benefits to hiring permanent nurses and keeping your unit staffed and not burning out your staff and so on. But with the financials, that's essentially what the equation comes down to.
Love it. And then we also get this question a lot, and we've gotten it today, which is, well, okay, you help us hire faster, but what about retention? And this is really interesting. Like, our retention rates, nurses that are hired through Incredible Health actually have higher retention rates at 1 year than their counterparts, which is really cool, and I think shows the types of health systems that we partner with and the good things they're doing, but also kind of the efficiency, right? If they're efficient in one area, they're probably really good in others too, that make these nurses want to stay. I just love this stat, and it's one we get every single webinar we do.
Yeah, there's a couple reasons for why the retention rate is higher than the hospital's baseline. One is that the nurse was able to consider multiple opportunities on the Incredible Health platform before selecting a specific employer. So it's a very well thought out job search as opposed to just taking the first thing you can get. And then the second thing is, like, honestly, our nurse network does skew a little bit older, a little bit more experienced, and more experienced nurses tend to have better retention than those that are earlier in their career. And so that helps the retention rate piece as well.
Love that. Okay. Let's talk through Q&A a little bit. We've still got a few more questions here, and we'll go to the top of the hour and then answer any other questions we can offline and via email as well. Okay, let's. Good question here. Variance in time to hire. Did we do any research on this, or even anecdotally, variance in time to hire in rural versus urban settings? Like, is there a difference there? Is there a large difference there? What do we see with urban and rural in terms of hiring? And rural, I'm learning in real time is a hard word to say.
Yeah. So for the main difference between rural hospitals and urban hospitals is on time to source, right? So there aren't as many nurses who are interested in engaging with a rural hospital compared to urban hospitals. And again, that's just, you can say that for any job in the country, right? Not just nursing. But however, what we do see once the nurse is engaged with the hospital or health system, we don't see a huge variance between urban versus rural. In fact, we have rural hospitals that move way faster than many of their urban counterparts. So the challenge they have is on the time to source. Can be a bit longer because there's not as many nurses who want to engage.
Right. Yeah, there's fewer to choose from in those markets. Virtual nursing. A couple questions. Karen asked one, just address virtual nursing. How could that impact this? The shortage generally. Anything you want to say on virtual nursing and any of the trends you're seeing as you talk to these leaders?
Yeah, it's a great question, Karen. So we are aware of many virtual nursing pilots and experiments happening across the country. Almost every major health system is putting some kind of experiment in place for virtual nursing, where they want to see the impact on outcomes, on patient outcomes, and on the employee experience too. The theory is that can we do more with less, right? Can we support multiple patients with some staff that's there in person, but also with staff that's virtual as well? And so that's like the open question. Honestly, the results are still TBD. Like, we're still waiting on the results of many of these experiments that are all kind of running now. And we'll see if there is an impact. I mean, I know that anesthesiologists have done something similar, or where, you can have more junior anesthesiologists in the OR, and you have a more senior anesthesiologist who's kind of overseeing multiple ORs virtually. And, we've seen it work in other parts of healthcare, but it's still unclear, TBD, if it's going to work from an outcome standpoint in nursing, but it's great that there's so many experiments going on.
Love that. We got a couple questions about the actual methodology of the study. Did we include domestic or international hospitals and nurses? These were strictly domestic in this case. They were U.S. Health systems, and then U.S. nurses or nurses willing to work in the U.S. Let's see, flexible scheduling. When it comes to, this is Colleen, when it comes to flexible scheduling, aren't different roles covering this issue, such as per diem, travel, etc., to create better flexibility for the permanent staff? So this might be a good opportunity to talk some options relative to flexible scheduling as well. But anything you want to add on Colleen's question, or just anything else on flexible schedules as well?
Certainly per diem is one approach. But what we're seeing is that just only having full-time and per diem is not enough, and the talent is asking for more options. They want part-time options. They want different shifts. For a variety of reasons, they're trying to fit their job into the rest of their lives. And they're also able to find employers that are willing to give them more flexibility. So it really is becoming a competitive advantage and imperative to accommodate flexibility.
So this is more of a comment from Jacqueline. She says, did your work measure aspects of the work environment? I'm a nurse and a researcher at Penn Nursing, and we consistently find the shortages, at least partially due to nursing, not to nursing school shortages, but due to poor clinical work environments that push nurses to leave bedside for other jobs, like telehealth or utilization jobs that allow for remote work. Have you seen this trend at all? So in
Yeah.
other words, like school shortages may be part of it, but the poor clinical environments might be a bigger part of it, is what she's suggesting.
I mean, 100%. I mean, just spot on. Like when we talk about the nursing shortage overall, there's multiple bottlenecks. We got one bottleneck at the nursing schools that are not training enough. We have another bottleneck that's happening at the end of their careers, where we have a huge portion of nurses that are retiring, right? So 25% of nurses are expected to retire in the next 5 years. The average age of a nurse in the US today is 52 years old. So this overall workforce does skew older. And so we do have a huge populations that are going to be retiring in the coming years. And then, yes, because of the workforce environment and the challenges and stress that's involved in working in that job, we are seeing more nurses than we did in the past permanently leave the profession because their skills are transferable and can be used by other industries and in other roles too. And so that's the sort of whole set of problems that we need to tackle together, and everyone's involved in this. It's the schools are involved, the health systems are involved, the technology partners are involved, and so on, in order to address this problem holistically.
Great. And then Eric asked a good question. There's two questions on career advancement. So Eric says, career advancement, question mark, for example, offering tuition reimbursement, paying for professional certificates, what else? So he's kind of saying, okay, well, career advancement, what do we mean by that, is the way I read the question.
So great question. Okay, so career advancement, again, like flexible scheduling, is a very broad term. And so career advancement includes multiple tactics. It includes how are we supporting new graduates to get specialized? So do they have specific programming for them? Are we helping nurses that are already experienced go into nurse management and leadership, and is there programming involved in that? It includes cross-training. So maybe you are already specialized in the ED and you want to cross-train into the ICU. Do we enable that or not? And then finally, like, do you have a very clear path for how your career is going to evolve at this health system at all times? And so it really includes a whole range of different tactics and strategies that have to be addressed. Certainly tuition and reimbursement and so on are helpful too, but it's really just about ensuring that the nurse can get the most out of, they are enabled to get the most out of their current employer in terms of their skill growth and their career development, so they don't look elsewhere.
That's great. And then Teresa asks, I've seen a lot of career pathways for frontline nurses, but haven't seen a lot of pathways for leaders. Seems like you just have to go to a bigger facility or move towards a CNO role. Nurse leaders want pathways too, smiley face. But I think the question is a good one, which is, what leadership pathways are there for nurse leaders?
Yeah, so a subset of health systems have leadership development programs in place, where it's not just about getting a nurse from the floor to go into nurse management, but even once you are a nurse manager, I mean, there's a whole set of skills that have to be built over the course of your career. It includes programming, like as an actual training, manager training, but it also includes involvement in committees, governance committees. It includes participation in innovation, participation in quality. So it is very much a multifaceted career. And so the more health systems can do to support that, the better.
Great. Okay, let's do two more questions and then we'll be done and send everybody on their way and let everybody get back to their day. So couple questions. Kathy asked one, and then there was another one below that said, essentially, are we seeing travel nurses move into permanent roles? Are there specific geographic areas or states where that's happening? Or is it just kind of broadly people are moving from travel into those permanent nurse roles? And we addressed this, I think, briefly a little while ago, but I want to hit on that again because I thought what you mentioned was really important there, Aman.
Yeah, it's happening broadly. It's not focused in any one market, but overall, yes, the trend is travel nurses are moving into permanent roles. It's always happened, right? It's happened before the pandemic, even during the pandemic, and now. So it hasn't, there hasn't been, there's that flow has always existed of travel nurses moving into permanent, but it's increasingly more so now because hospitals and health systems are doing so much to reduce the number of travel nurses, and because nurses are just fatigued, right? Like working as a travel nurse is tiring, and there is a strong desire to move into permanent roles because it's more stable and you have more control over your hours and so on. So.
Great. And then Philip asked this, and there's a couple of people who've asked similar questions, which is, are we seeing similar shortages? We deal with nurses, exclusively right now, but, are we seeing similar shortages in other professions, whether it's laboratory medicine, physician's assistants, et cetera, et cetera, et cetera? Because he says we have the same staffing problems for other roles that are not as visible as nursing. Are we seeing that as well, that there's shortages in other areas? And what are you hearing from your hospital leader colleagues in those areas, Iman?
Yeah, I mean, the quick answer is yes, absolutely. I mean, from day one, from starting Incredible Health in 2017 till now, we are constantly getting asks from the employers that we work with about technicians, about other professions in healthcare, and when we are moving into them. So definitely, the shortage is not exclusive to nursing. Now, nursing happens to be the biggest clinical workforce in the country, which is why we're focused on them. But it certainly is. The shortages are prevalent in other professions too, in healthcare.
Okay, so Philip's, I think, now officially begging us to move into those areas, just so you know. Philip. Okay. Awesome. Well, this was great. Thank you so much, everybody, for jumping on. So many wonderful questions. And a lot of great discussion. Yeah, go ahead, Iman.
Yeah, I want to just mention a couple of quick things. One is I believe a member of our team will be in touch with the recording and with the actual report itself. And so if there are any additional questions, please feel free to email us at questions@incrediblehealth.com. You can also sign up for a demo on our site. And then the last thing I just wanted to leave everyone with is just hope. I know we went through some tough statistics today and data, but this is a very hopeful time in nursing. And the reason I say that is because there's so much attention on this workforce right now, from the hospital executives, from the media, from so on, right? And so with this much attention, that means that there's going to be change and strategy and innovation and tactics that get implemented and so on in order to solve these very tough problems. Certainly more now than I've ever seen in my career. So I'm really hopeful for the changes to come that will make this profession more sustainable and more attractive for nurses.
That's great. What an awesome way to end it. And like Iman said, we'll be in touch with the actual full study. And then if you do have questions about Incredible Health, please reach out. You can go to our website, request a demo. You can email us at the email address on your screen as well. So with that, Mariah, why don't you take back over, and thanks for taking the time, everybody. We really appreciate it.
Yeah, absolutely. Thank you both so much. Like you said, that's all the time we have for today. So I do want to thank Iman and the team for an excellent presentation, and Incredible Health for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you again for joining us, and we hope you have a wonderful afternoon.